Keeping an eye on your health today, believe it or not, many doctors consider America to be in what they call a healthcare crisis. From long wait times to advanced technology, they say we are in a unique place when it comes to our health. Our medical expert, Dr. Bose, explains.
Doctors are already very busy, but the one thing is we've advanced medically, and that's a good thing. I mean, diseases like congestive heart failure, cancer, AIDS that were once terminal, they used to lead to death. They're becoming chronic conditions. People are dying with the AIDS these days instead of AIDS. So that adds more strain to the system because there are more patients now as we have to take care of these chronic illnesses. And there's diagnostic and treatment options for these, more screenings for these, and
there's more services also.
Exactly.
And it's just kind of putting a strain onto the system. But there's also something else that you brought up before, we were talking before this segment that I didn't even think about, the doctors, baby boomers.
Right. So what happened after World War II? Everybody went and had a baby. So we had the baby boomers who are now aging. What does that lead to? How does that lead to our healthcare crisis? Number one, the doctors who are baby boomers are retiring. So it's projected by 2025 that there's going to be a shortage of 150,000 physicians. That's a lot. Yeah. And in addition, the patients who are baby boomers, they're aging. So what does that mean?
They need to go to the doctor.
Right. So as you get older, you need to go to the doctor more. So that's putting more strain on the system. So not only us advancing in chronic conditions and the population aging, there's other scary statistics that by 2030, almost half of all Americans will be obese. And 1 out of every 3, meaning me, you, and you, 1 out of 3 of us will have diabetes. So don't be that person.
Yeah,
you know?
Absolutely. What can you do about this? What could this solution be?
So when we talk about this healthcare crisis, you're going to hear it from the government, you're going to hear it in the media, you're going to hear it everywhere, you're going to see it when you go to your waiting room. The main thing you have to do is be proactive. There's a lot of things you can do about your own health out there. So we've talked about this. What do we got to do?
Got to exercise.
Got to exercise. Remember, keeping a healthy weight. What's this?
Eat healthy.
Eat healthy. This is very important. And there's a lot of other things you can do as well. There are technological advances. There are great apps to contact your doctor virtually, apps like Live Clinic. And
other websites as well.
And websites where you can stay educated. There's, for example, the American College of Emergency Physicians has emergencycareforyou.org. Or you can tune into our segments every week and stay educated, or on our Facebook pages. We welcome you there. Thank you for listening.
All right, very good. Dr. Bose, thank you so much.